Health problems and declining quality of life rank as a top concern for Generation X as they age into their 50s, 60s, and beyond. Recent surveys and studies highlight fears of serious chronic conditions, being sicker than their parents at the same age, rising healthcare costs, access barriers, and the broader impact on independence and daily living. Many Gen Xers feel cost-desperate for care or medications, amplifying stress in an already high-pressure life stage. Multiple studies point to a generational shift where Gen X experiences poorer health outcomes compared to previous generations at similar ages. A 2021 national study from The Ohio State University, using data from the National Health and Nutrition Examination Survey and National Health Interview Survey, found that Gen X and Gen Y millennials showed poorer physical health than baby boomers and earlier cohorts. This included higher metabolic syndrome markers, chronic inflammation, and reduced renal function. Mental health also worsened, with increased depression and anxiety, alongside unhealthy behaviors like heavy drinking and smoking. Researchers warned of potential higher disease and mortality rates as these generations age. A 2020 analysis of England's health survey data echoed this, showing people in their 40s and 50s in worse shape than those in their 60s and 70s were at the same age. They reported higher rates of bad general health, long-term illness, high blood pressure, diabetes, circulatory issues, hypertension, and overweight, obesity. While life expectancy has increased, more years are spent in ill health. Over half the added life expectancy from the 1990s to early 2000s was projected to involve poor health, linked to diet, less exercise, and social inequalities. More recent data reinforces chronic condition trends. A 2025 CDC report on multiple chronic conditions showed rising prevalence earlier in adulthood. Midlife adults, including Gen X, at 78.4% having at least one chronic condition and 52.7% having multiple. This burdens quality of life, increases costs, and reduces functioning. Cancer rates add another layer. A 2024 study projected Gen X facing higher per capita rates than baby boomers for several cancers, potentially tied to lifestyle and environmental factors. These trends suggest Gen X may face more years of ill health than boomers despite medical advances, contrasting with some earlier views, but overall pointing to a reversal where later generations bear heavier chronic burdens. Some data offers a balanced view or highlights Gen X strengths. A workforce health index analysis notes Gen X often leads in healthy behaviors, 47.9% exercise regularly, better sleep, lower reported stress, and high home cooking. They show wisdom in turning awareness into consistency, delaying some declines despite aging biomarkers like higher prediabetes, diabetes, and cholesterol issues. The Mather Institute's 2025 Gen Experience Year 2 report found 67% of Gen Xers rate their physical health as good or very good, though mental health lags. Only 45% very good excellent versus 57% for boomers. High stress drives poorer mental ratings, but many adopt wellness tech with positive impacts. Comparisons sometimes show millennials faring worse than Gen X at similar ages, suggesting the decline may accelerate in younger cohorts rather than uniquely plague Gen X. Gen Xers dread these issues, not just for mortality, but for quality of life, losing independence, becoming a burden, or facing unaffordable care amid sandwich generation pressures. Surveys confirm health and healthcare costs top retirement worries, outranking money for many. Chronic conditions tie into financial strain, mental toll, and lifestyle regrets. Yet, Gen X's resilience shines through. Pragmatic habits, tech adoption, and redefining aging via prevention. Prioritizing these could mitigate risks and extend health span. The generational health gap is real and concerning, but Gen X has tools and experience to push back. Proactive steps today can help rewrite the story for healthier later years. Generation X, now in midlife, faces heightened risks for chronic conditions like heart disease, diabetes, hypertension, metabolic issues, and certain cancers compared to prior generations at the same age. The good news? Evidence shows that proactive, practical steps can significantly reduce these risks, improve health span, and offset even genetic predispositions. Sometimes dramatically, as studies indicate lifestyle changes can lower heart disease risk by up to 14-fold. Here are evidence-based, realistic prevention strategies tailored to Gen X realities. Juggling work, family, stress, and time constraints. Focus on sustainable habits over perfection. 1. Prioritize regular preventive screenings and checkups. Early detection is key for Gen X, as many issues emerge in the 40s to 50s without obvious symptoms. Start or maintain screenings in your 40s, blood pressure, cholesterol, and blood glucose tests. Discuss family history for personalized timing. Cancer screenings, colorectal, mammograms, prostate discussions, and others based on risk. Routine wellness visits, annual checkups, plus vaccinations. Why it matters for Gen X, CDC and USPSTF guidelines emphasize these for midlife adults to prevent or manage chronic diseases before they advance. Make appointments non-negotiable. Treat them like important meetings. 2. Adopt a heart and metabolism-friendly diet. Diet directly combats inflammation, weight gain, high cholesterol, and blood pressure, top concerns for Gen X. Emphasize plants, fruits, vegetables, whole grains, legumes, nuts. Aim for variety. Follow patterns like Mediterranean or DASH, lean proteins, healthy fats, limit processed foods, salt, added sugars, and harmful fats. Practical tips: home-cooked meals most days, portion control, and occasional treats without guilt. Consistency over all or nothing. Bonus: limit alcohol and quit smoking if applicable. Huge impact. Heart risk drops 50% in 1 year after quitting. 3. Build consistent physical activity. Exercise counters metabolic syndrome, obesity, inflammation, and even some cancer risks. Aim for 150 minutes moderate intensity weekly, or 75 minutes vigorous. Break into 30-minute sessions 5 days a week. Include strength training 2+ days a week for muscle maintenance and bone health. Gen X-friendly ideas: walking meetings, home workouts, apps trackers, or fun activities like pickleball or hiking. Start small if needed. Consistency builds momentum and reduces fall risks later. 4. Manage stress and protect mental health. Chronic stress accelerates aging, worsens inflammation, and ties into financial family pressures common for Gen X. Daily practices: mindfulness apps, short meditation, deep breathing, or journaling. Boundaries: do less and care less in a healthy way. Set limits on work/family demands. Prioritize self-care. Social connections: combat isolation through friendships, family time, or groups. Strong networks support mental and physical resilience. Professional help: therapy or counseling if stress feels overwhelming. 5. Leverage technology and build support. Gen X often adopts wellness tech pragmatically. Use trusted tools, fitness trackers, apps for nutrition, sleep, or AI platforms for reminders. 84% of users in reports see positive impacts. Accountability: exercise buddies, family goals, or workplace programs. Sleep: aim for 7+ hours nightly. Crucial for hormone balance and recovery. 6. Avoid or mitigate key risks. No tobacco, moderate no alcohol. Maintain healthy weight BMI through combined diet, exercise. Monitor and manage emerging issues. Gen X's strengths: pragmatism, resourcefulness, and experience surviving economic ups, downs. Position you well to implement these.
Small, consistent changes compound over time,
Potentially adding healthier years and reducing the dread of declining quality of life. Consult your doctor to tailor these to your personal risks/family history. You've got this. proactive steps now can redefine aging on your terms. Health span refers to the number of years you live in good health. Free from significant chronic diseases, disabilities, or conditions that impair daily function, independence, mobility, cognition, or quality of life. It's distinct from lifespan, which is simply the total number of years you live, regardless of health status. The key difference: while modern medicine has extended average lifespan, health span often lags behind by about 9 to 12 years on average globally. This means many people spend the last decade or more of life managing chronic issues like heart disease, diabetes, arthritis, cognitive decline, or reduced mobility, leading to dependency, lower enjoyment, higher healthcare costs, and strain on family/caregivers. Extending health span focuses on compressing morbidity, delaying the onset of age-related decline, so you stay vibrant, active, and independent longer, ideally until near the end of life. This aligns perfectly with Gen X concerns about declining quality of life, becoming a burden, or facing chronic conditions earlier than previous generations. Prioritizing health span offers profound evidence-based advantages over just chasing longer life. Higher quality of life and independence. More years of vitality, energy, mental sharpness, physical capability, and emotional well-being without major limitations. Studies show strong adherence to healthy habits can add years free of major chronic diseases like diabetes, cardiovascular issues, and cancer. One large analysis found women practicing 4 to 5 healthy habits at age 50 lived about 34 disease-free years versus about 24 for those with none. Reduced risk of chronic diseases and frailty. Lifestyle factors lower inflammation, metabolic issues, and age-related decline. Following frameworks like the American Heart Association's Life's Essential 8 promotes healthy aging, cuts risks for multiple illnesses, and supports both longer and healthier years. Lower healthcare costs and societal burden. Extending health span by even 1 year in portions of the aging population could save billions in entitlement programs. Estimates of $29 billion per year reduction in U.S. costs, while boosting economic value through sustained workforce participation and reduced caregiving needs. Mental and emotional gains, better protection against dementia, depression, isolation, and stress-related issues. Physical activity, social connections, and stress management preserve cognitive function and psychosocial health. Potential to close the health span-lifespan gap. Interventions delay onset of multiple age-related diseases simultaneously, leading to more good years rather than prolonged illness. Evidence from longitudinal studies and reviews consistently links these benefits to modifiable factors: diet, exercise, sleep, and stress reduction, often yielding bigger impacts than genetics alone. The practical steps we discussed earlier directly target health span extension. Gen X's pragmatic mindset makes these sustainable. Consistency compounds, potentially offsetting earlier onset chronic risks seen in studies. In short, health span isn't about immortality, it's about maximizing vibrant, fulfilling years. By focusing here, Gen X can redefine aging, not dreading decline, but embracing more active, independent decades. Small, steady habits now pay off hugely later. Consult your doctor to personalize.